I think the doctor may have to do a little bit more research and find out where we're going as a nation. Yeah, we're not just think at random. You know, there's some deliberacy. We get some deliberacy in with thought around this. So, for example, let me just take the issue of postgraduate training. Yeah. I think it's really important for understand the rationale for training here in country. Sierra Leone has been the watershed of education. Everybody they kind of for Canada. Every time we send students in come on air, go other side, then they excel, then they top the class. You know, so in terms of the student quality, we get extremely higher. You know, the faculty that with the Ghana, with the Kenya, now then colleagues in there, yeah. So then they go say, in fact, every now and again, when they send people in for medical care overseas, they say, why are you sending them here when you have that capability there? So again, I think say we as a nation need for become really proud of who that we be, and for rebuild we nation, because nobody else in the can build for we. Yeah, the doctor then preference again. I think say we get to be careful. The other day we lost Dr. Peters. Yeah, Dr. Peters will not be OBGYN. Why they grew up na Kenema. Yeah, everybody they worship Dr. Peters. You know, the only woman name, not a young doctor. He passed outside. He said, "Darling, I'm a doctor." Yeah, not so financial gains. You know, where you did get as a doctor, now for motivate you.
That's not an incentive?
You know, no, the financial component of it is secondary to the service. It's secondary to your national effort, you know. Because again, if you want more money, if me want more money, I got a reduction in salary by nearly 90%. For like I accept this work now. So your motivation not to money, not your motivation, we'll go Ghana for better care. Ghana then the castle for can learn from we. So we get an opportunity for rebuild our own system. We didn't say, okay, well, we're able for afford for pay for we doctor then now. Why we want for train more doctors? We're able for manage the hospital that we'll get now. Why we want for open more hospitals? Well, the answer is simple. Yeah. You get for go back and say, what should we do better and differently, and be ambitious about those goals. Be ambitious and back that ambition with the resources.
Ambition also costs money.
With the resources for it. Again, the amount of inefficiencies that we have in the system is mind-boggling, is baffling. All of these drugs that are coming in that are free healthcare, if we had effective systems in there, it'll be reaching and beginning the kind of impact that we have. The inefficiencies are glaring. So I think what I would like to encourage the doctor and his colleagues is for us to come together and see how do we build a robust healthcare system that's forward-looking, forward-leaning. The population is not waiting for us. When we grew up in the 60s, Sierra Leone's population was 3.5 million. Yeah? Now we're hovering at 8 million. Yeah? We have to do something. We have to do something and bring more efficiencies and bring more well thought out approach to this, get more resources in the system and manage those resources better. So again, you can't say, well, because we can't manage this, so let's not do anything about it.
And about the plans for SLESHI, don't just be the highlight, some challenges what that comes with a system like that.
So SLESHI now, which is called Health Osusu. Yeah? Health Osusu. It's never going to be perfect anywhere. Yeah? What happens is the bulk of the people fall within, there's a bell curve, you get a bell curve. The bulk of the people didn't fall within that middle. You get extremes on either side. So what they happen now for find a way for address outside the bulk of the people in there. And then you look for alternative ways for address the extra, the one that we do on the extremes. Like for example, if you allocate 1 million or 10 million per person, yeah, so for trauma. If somebody go get motorcycle accident, a broken foot, the per capita of 10 million, it don't go very, very quickly. But the idea now, if you pool all that resource and you get more people in for subscribe to it, you get a bigger pool where you work on. And this pool here you can invest them, it can bring dividends to you, and the government input, now safety net for people that were able to afford them. We go Senegal, they're not to force anybody to take health insurance, yeah? But when you go when I go to the hospital, the first thing they ask you now, we health insurance, yeah? If you say you don't get health insurance, then we'll still provide the service for you, but you pay premium costs. If you get the health insurance card, where they cover a group of services, you get next to nothing.
How do you make sure, say, this not also turn to free healthcare part 2, who say where you go to hospital and paracetamol no more available?
No. Because what you happy, you forget essential package. You get essential package with the insurance they cover, you know. And the insurance coverage, it covers several things. First, it cover the drugs, it cover the diagnosis, it cover participating hospitals, as well as participating physicians, you know, caregivers. So everybody where they get their own cut out of it. Now that they happen now, but not out of pocket. But what you want to do that for bring the system inside the way they cover the bulk of them, you know, such that most people then go benefit from the services.
And spend very little.
The whole idea now for reduce the out-of-pocket expenditure, you know, and now for reduce that burden there on the person where they utilize the service. Again, it's not a perfect system, but what's the alternative? The government cannot be pouring money into all of this all the time, and then you expect the standards, the quality to be raised to the high level. Something has to give. I mean, I did in the UK where they get the big debate around the NHS, yeah, the National Health Service System. The issue, the way Margaret Thatcher tell us, say, you now get two choices, yeah? Either we tax on more and retain the quality, or we reduce the quality and tax on less. But in the end, somebody get for pay for it. When you say free healthcare, it's not free. Somebody get for pay for it. And the government they pay for it, and the taxpayer then they pay for it. So the issue now, what do you want for pay for? You know, and I think that's something where we go evolve, not a magic bullet where you can't today solve all the problem there, but it will solve the bulk of the problem and reduce the burden on it.